Welcome to the Creative Synthesis podcast. Today's episode is from the series Words Aloud, where I'll be reading from one of my blogs out loud to help reach the people that matter. Today's blog is Navigating Creative Health Advocacy at ICB Board Meetings. For advocates of creative health who want to champion the role of cultural and heritage provisions within healthcare settings, connecting with their local integrated care board can be an effective strategy. By attending ICB board meetings and raising targeted, evidence-backed questions, advocates can spark conversations that lead to meaningful action. In this blog post, I will provide a guide to understanding and leveraging ICB board meetings for creative health advocacy. The key takeaways are as follows. 1. Conservation focus. ICBs primarily focus on maintaining local NHS services amid financial constraints. For creative health advocacy to be meaningfully considered, it cannot be positioned as something which threatens this conservation. Cultural change is desired, but via manageable changes and ongoing monitoring of risk. So, it is important to identify meaningful and readily actionable first steps. 2. Transformation requires alignment. Boards prioritise innovations that meet pressing local needs and promise long-term resource savings or risk reductions. There is a plethora of evidence on the benefits of creative health, so it's becoming increasingly easy to identify quality papers that align to local priorities and reduce the perception of risk through evidence-backed data. 3. Creative health needs integration. Many board conversations discuss the need to be tighter and tighter with their priorities in order to make large-scale and sustainable change. Without a direct link to ICB priorities, creative health risks being sidelined below a long list of other health concerns waiting their turn for prioritization. To achieve success, advocates must present proposals tied to pressing board concerns. If this is the type of advocacy that aligns well to your goals, then read on to find about the format of ICB board meetings, examples of how to make questions relevant to agenda items, and tips for effective advocacy. The format of ICB board meetings. ICB board meetings are meetings held in public, not public meetings. This distinction is key, as members of the public can attend as observers but cannot actively participate in discussions or add items to the agenda. Here's what to expect. The setting. Board members sit at a circular table and are sometimes joined by guest presenters. Name tags help identify participants. Members of the public, usually a small number, sit to the side, silently observing proceedings. The agenda. A detailed document filled with progress reports is available online ahead of the meeting. These reports are usually taken as read and only summarise during discussions. Discussion format. Board members comment on agenda items and ask questions to achieve decisions or assurances. Timeline. The publicly accessible sections of ICB board meetings typically last between 2.5 to 3 hours. Occasionally, topics of a sensitive nature are then discussed in private following a break. Public involvement. Whilst public attendees cannot raise new topics, they can submit questions about agenda items in advance, typically at least 2 days prior. Depending on the ICB, meetings can either be held in person, online, or through a hybrid structure. Information is available via the ICB website. Examples of how to make questions relevant to agenda items. In November 2024, I attended ICB board meetings across the Midlands to better understand how to engage with them. Below, I outline 3 examples of questions I asked and what resulted to give you a flavour of what is possible. My first example comes from Derby and Derbyshire ICB. The agenda items were staff survey, workforce retention and capacity. Here's how I worded my question. Matters relating to workforce satisfaction and retention have been discussed in today's meeting. Are the ICB aware of the work that the arts team at the University Hospitals of Derby and Burton NHS Foundation Trust is pioneering in relation to workforce wellbeing? Their work will be shared with the National Arts in Hospitals Network, demonstrating a great opportunity for Derbyshire to become national leaders in this space. Here's the outcome. The Chief People Officer, Lee Radford, requested a meeting with Laura Waters, the head of the UHDB arts team, stating, "The health and well-being of our people is a key cornerstone of attracting, developing and retaining our system workforce. While the ICB is not directly aware of the arts team's work at UHDB, it would be really helpful to arrange an induction meeting with the new ICB CPO, who is currently strengthening the ICB's People and Culture Committee, who have responsibility for the 10 ICS mandated people functions, one of which is the well-being of the system workforce. It would be great to understand the opportunities that Creative Health has to offer, which could support wider system integration work." My next example comes from Coventry and Warwickshire ICB. The agenda item: Voluntary Community, Faith and Social Enterprise Alliance. Here's how I worded my question. It's fantastic to see such a commitment to VCFSE engagement at the ICB. So far in your work, have you found that the arts sector are making up a reasonable portion of the VCFSE alliance and commissioned partners? Typically, they do not consider themselves part of the VCFSE sector yet. The health benefits of arts engagement is well evidenced and could have a significant impact on ICB priorities. Here was the outcome. In the meeting, the Chief Medical Officer, Angela Brady, responded, "Our collaborative for the VCFSE is still forming, and we do need to make sure it's representative of the breadth and depth of voluntary sector charities and community groups which are across Coventry and Warwickshire. We do recognise the value of the arts, particularly in mental well-being and social isolation, but we need to bring that into our work in our prevention network. At the level of place, we need to make sure that we are inclusive of all viewpoints. The other element that we have is the VCFSE portal. This launches in December and is important to highlight that any group will be able to register to be a member. So we would urge all third sector groups and organisations to consider signing up to be part of that, because that portal will connect you through to some of our prevention network work that we're doing at place." Following the meeting, I was also able to connect with the consultancy group that are developing the portal to consider how artists can be best reached and included. My final example comes from Nottingham and Nottinghamshire ICB. Here there were 2 agenda items I wanted to comment on. The first, the citizen story, entitled Experience of Autistic People and Citizens with Learning Disabilities. Secondly, the finance report. I had 2 questions. 1. Have the ICB considered the place of creative health in neurodiversity personalised care? See this resource for another citizen story / exploration of creative health. I then linked them to my blog about my experience of using creativity for neurodiversity. Number 2. Have the ICB considered the place of creative health in reducing the costs associated with core / major health priorities? See this at a glance resource for key stats. The resource was my Creative Health at a Glance booklet, which looks at core 20+5, major conditions and falls prevention. Each page has 3 to 4 stats looking at how creative health affects these conditions. The outcome? The ICB chair, Kathy McLean, thanked me for providing the At a Glance resource and commented that it was a succinct guide that may be of use to numerous members of the board, including the Director of Finance, Marcus Pratt. She pointed towards the Director of Nursing, Rosa Waddingham, to follow up in the first instance. Rosa expressed interest in the place of creative health, particularly in relation to the ICB's neurodiversity pathway, and pledged to review the linked resource. Conclusion. Tips for effective advocacy. By strategically engaging with ICBs, creative health advocates can position cultural and heritage provisions as valuable, actionable solutions to local healthcare challenges. To do this well, advocates can follow these top tips. Do your homework. Review the agenda in advance and identify items that align with creative health. Submit precise, targeted questions. Connect creative health solutions to the board's priorities and provide evidence to support your case. Be specific. General advocacy for creative health may not resonate or even be accepted as a question that is relevant to their agenda. Frame questions to align with immediate healthcare challenges or opportunities for innovation that appear in the agenda. Provide resources. Include links to evidence or case studies that bolster your argument. This blog was originally created for the National Centre for Creative Health whilst I was operating as their Midlands Creative Health Associate. I was acknowledged at the bottom of the page when this was published in December 2024. For more resources and insights from the associates, you can visit the news and blog page of NCCH at ncch.org.uk/news, or visit the Creative Synthesist website where you'll see all the blogs that I created, and you can also visit my YouTube channel or any of our audio platforms and social media where you can hear these Words Aloud podcasts.